My name's Jason Rothenberg. Grew up in central New Jersey, about an hour south of where we are now. Been in practice since 2004, been on my own since 2008. Kind of found my way into dental profession as probably about a junior or senior in college. And then once I got to dental school, we took our first ortho course as sophomores, and it just kind of clicked for me. 8-9 months before I finished my residency, I sent out, 150 resumes all over. My predecessor got a resume of mine and ended up getting the job up here, took it with him. It was the best opportunity that I had. We worked together for almost 4 years before he decided to retire, and I took over the practice at that point. Still is an incredibly good mentor. He's like a second father to me. Really taught me not only how to execute the business and run the business aspect of things, but really how to listen to patients, how to understand what they're saying, how to speak with patients, how to get people to understand what we're trying to communicate at a level where people will get it. I think the biggest thing was honesty. If a patient came in, not every single person in the world needs to have braces. Not every single person in the world needs to have a palate expander the minute they turn 7 years old. Just explaining to people what their options are, pros and the cons of what we could do versus not do, and kind of guiding the patient to what I felt would be in their best interest, and letting the patient choose, for themselves. Do unto others as they want done to them, so to speak, is really help them own their issues, understand their issues, and make the best decisions for themselves with all the options that are available there. It's what makes them confident. There are certain parameters and what we think a smile should look like, but there's also a tremendous individual component. What one person finds as an attractive smile and tooth position is not necessarily the same as what somebody else does. So we try to take a more customized approach per patient and say, okay, are you happy with the progression of how things are going? Do you feel like the teeth are too far forward or too far back, or do we want to change this or change that? And there are a lot of customizable options from that standpoint. So really, it's more about what the patient finds as a confident smile. We have a couple of differentiators. I think we're very ahead on the technology. I think a big part is also the honesty, giving the patients their options, letting them choose their options, and then delivering good quality results. Being able to give people that customizable, beautiful smile that they're looking for. And then also giving them that experience, coming in here and having a good, pleasant experience. I think that's really the biggest thing people are looking for nowadays. To me, a Rothenberg smile is a nice, broad smile that's balanced within a patient's facial structures, that a patient can be 100% happy and confident with.